When you hear the letters OCD, you probably picture someone who's, super neat, maybe a little quirky about being organized. But the reality of obsessive-compulsive disorder, it's so much deeper and more complex than that stereotype. Today, we're going to go way beyond the surface to explore the hidden internal world of OCD, starting with an idea that's right at its very heart.
So we're starting with this image because it really gets at something fundamental to the OCD experience, this terrifying concept called magical thinking. For someone with this disorder, a thought, just an internal thought, can feel as real and as dangerous as something happening right in front of them. It's this belief that your mind has this frightening power over the world, that a dark thought could just leap out of your head and cause actual real-world harm.
Just let that sink in for a second. The thought is equal to the deed. What that means is, just having an unwanted, aggressive thought, like a quick flash of wishing someone would get hurt, feels exactly the same as if you actually went out and did it. It's not just a worry, it feels like a direct, personal, moral failure. I mean, really, imagine that. What if your own mind, the one place you can never ever escape from, became a source of constant danger? That's the day-to-day reality for so many people living with OCD, and it's the engine that drives this whole thing.
So to really get a handle on OCD, we have to pop the hood and look at that engine. It's this powerful, self-sustaining loop made of two key parts, obsessions and compulsions. Let's break down how they work together to create this really vicious cycle.
Okay, so first you have the obsession. And listen, this is not just everyday worrying, not by a long shot. These are thoughts that feel like they're invading your mind. They're totally unwanted, and they cause some serious anxiety. We're talking about a persistent fear of being contaminated, a nagging, gut-wrenching doubt that you left the stove on, or a really disturbing, violent image that just flashes into your mind uninvited and totally unwelcome. And all that intense anxiety from the obsession, that leads directly to the compulsion. This is the action part, the doing part. It might be a physical thing, like washing your hands over and over again, or it could be a totally mental act, like praying or counting in a very specific pattern. But here's the crucial thing. It is not done for pleasure. It is a desperate attempt to just neutralize the fear that the obsession created.
And here's how it all gets locked into place. Step 1, the obsession hits. Bam. Step 2, anxiety just skyrockets. Step 3, you perform the compulsion, the ritual, to try and make that anxiety go away. And step 4 is the trap. You get temporary relief. And in that moment, your brain learns, hey, that little ritual, it worked. And by doing that, it reinforces the entire loop, making it even stronger and harder to break the next time that obsession appears.
So why? Why does this even happen? What are the deeper roots of this debilitating cycle? Well, there's no single simple answer. But psychological theories point to some really fundamental human conflicts that can help us understand the themes that pop up so often in OCD.
Now, what's really interesting is seeing how these ideas connect. Take ambivalence, that very human feeling of having, say, intense love and also intense anger toward the same person, like a parent or a child. Now, combine that with magical thinking, where you believe your angry thought could actually harm that person you love. You can start to see why someone might become completely preoccupied with themes of aggression, right? Or why they might turn to cleaning rituals as a way to wash away those dirty, dangerous thoughts.
It is also so critical to understand that OCD is not one singular thing. It shows up in several pretty distinct, though sometimes overlapping, patterns. So we're going to walk through the 4 major types right now.
All right, first up is the one most people think of, contamination. This is the most common pattern. The obsession is a fear of things like germs, chemicals, dirt, you name it. The compulsion, then, is excessive washing, cleaning, or just avoiding anything that could possibly be contaminated. And this can get so severe that people literally can't leave their homes or touch the people they love or live anything resembling a normal life.
Now, this chart might actually surprise you. While we totally associate OCD with washing, and yeah, it is very common at 50%, look at what's number 1, checking, at a massive 63%. And that leads us directly to the second major pattern of OCD.
Pathological doubt. This is the obsession that something absolutely terrible is going to happen because you weren't careful enough. Did I turn off the stove? Did I lock the car door? Did I accidentally hit someone with my car? The obsession is that relentless, nagging doubt, and it's fueled by this deep, deep fear of being responsible for some awful tragedy. And the compulsion? It's the endless checking to try and get a sense of certainty that honestly never really comes.
This case study of a woman, Miss K, is just such a powerful real-world example.
For her, it wasn't just a quick double check. Her doubt was so profound and the compulsion was so forceful that she was physically breaking the handles off her car doors and was consistently massively late for work. It just shows you how devastating this pattern can be. It just destroys lives from the inside out.
And Miss K is far from alone in this. As you can see here, 42% of people with OCD experience these obsessions of pathological doubt. That's millions of people, each with their own story, trapped in a very similar cycle of fear and checking.
The other two major patterns are a little bit different. On one side, you've got intrusive thoughts, which can be purely obsessional, just terrifying, unwanted thoughts, maybe sexual or aggressive, that can make a person question their own character, fearing they might be a monster. And on the other side, there's a need for symmetry, where this overwhelming drive for things to be just right can slow daily life down to a crawl.
So, with all these different ways it can present, how is OCD actually diagnosed? Well, it's often more complicated than you might think. And sometimes, the very first clues are found in the most unexpected places.
I mean, take a look at this. A dermatologist might be the first person to see the chapped, raw hands from compulsive washing. A dentist might notice gum damage from brushing your teeth too much. This shows that the physical results of the compulsions often bring a person to a doctor long before the underlying psychological cause is ever identified.
Okay, so once a clinician does suspect OCD, one of the most important things they look at is the patient's level of insight. And what that really means is, does the person recognize that their obsessive beliefs are irrational? Or do they truly believe their fears are justified?
And insight isn't black and white. It exists on a spectrum. A lot of people with OCD actually have good insight. They know the fear is illogical, but they just can't stop the feeling. Others have poor insight and think, yeah, my fears are probably real. And in some cases, there's what's called absent insight, where the beliefs are held with 100% conviction. The crucial point here is that two people can have the exact same obsession, but a completely different and equally painful relationship to it.
Which leaves us with this final thought. Knowing that a disorder isn't just about the symptoms, but it's also about a person's belief in those symptoms, well, that really complicates our picture of mental health, doesn't it? It reminds us that behind every label is a complex individual human experience, a struggle not just with thoughts and behaviors, but with the very nature of reality itself. And that's a struggle that deserves our deepest empathy and our deepest understanding.